Risks associated with the surgeries change with what surgery you're talking about. They change with what child you're talking about and even what age the child is. Most of the early surgeries are kind of a little bit more superficial tissue rearrangement. So there's not much risk there to the patient. There's always surgical risk like infection, like the need for revision in the future. Anesthesia obviously is a risk to the patient that we try to manage. One, by having a surgical schedule, calendar of events, so to speak, and for that patient, where we try to abide by guidelines that are provided by, among others, Anesthesia Society of America's guidelines on general anesthetics in kids. And so we try to be thoughtful about when we recommend an anesthetic, because so much of what we do to children it requires anesthesia for it to be done right. So we're aware of the risks associated with anesthesia, and that does influence the timing of our surgery to a certain degree. As kids get older, we start moving into that phase of surgery that's more hard tissue management. So that's your nasal floor reconstruction and ridge grafting involving hip graft. Risk there associated with that is a little bit more like it would be for orthopedic or general surgery, and obviously the baseline anesthetic risk as well. And then as you move into the later years, now we're getting progressively more invasive, and that's our rhinoplasty, possibly, but at least for the average patient, jaw surgery. Fortunately, we in this practice have a long history and legacy that we can be proud of premier jaw surgery as well, going back 30 plus years by the surgeons that founded our practice, and the model for how we deliver that care on an outpatient basis is one that's garnered international attention. So we're very, very proud of that, but we never take for granted the possibility of complication is there right around the corner. So you can't eliminate all risk, but there's definitely a preparedness and a mindfulness that goes into the care of the surgical patient that permeates everything that we do. I don't know that I'm really trying to pioneer a new way of doing anything. There's some great ways to do it already. I'm just trying to perfect it and get better and better and better, and take those little aspects of it that we look back at the results and say, gosh, we love it, but if we could have just done this or this, and try to eliminate systematically what those are. So maybe in the next 20 years, I'll get to the pioneering part, but a refinement is maybe the way to say it. My focus is just constant pursuit of refining what we know is working in an attempt to make this the result as seamless and perfect looking as we can.